Thanks for having me. Well, joining us at the table now is Congressman Tim Murphy, a Republican from Pennsylvania. Good morning.
Morning, Paul. Great to be with you.
Our guest is a member of the Republican Doctors Caucus. You are co-chair,
Yes.
and wanted to talk to you, of course, about the health care vote. With the Supreme Court having ruled on the health care issue, why is it important for the House to take up a full repeal today and tomorrow?
Well, it is, once again, a way of saying that this bill is not real health care reform. It's neither affordable nor is it health care. It is going to cost a massive amount in tax increases. It's a massive increase in federal bureaucracy between patients and their doctors. I don't believe it's resolving the issue as the way we want it to. I mean, just look at how much health insurance has gone up since the time this bill was enacted into law, $1,800 for the average family, according to the Kaiser Foundation. We're very concerned about the 158 boards, panels, commissions, programs, the 1,978 new responsibilities of the Secretary of Health. That's a lot of bureaucracy between patients and doctors.
Our guest is a practicing psychologist for 30 years, and Congressman Murphy is here to talk to us about the health care debate, which begins in the House of Representatives today, shortly after noon. They'll begin 5+ hours of debate with a final vote on this repeal tomorrow. Tim Murphy, the congressman, is a member of the Energy and Commerce Committee as well, and should point out on this repeal bill, it's a closed rule, so it's basically one bill, no chance for amendment, with a final vote coming up tomorrow. Some are criticizing the GOP, Congressman, that this is distracting from that jobs and that economic focus. How would you respond to those?
Well, this is an important job issue. The CBO and other agencies estimate this bill is going to cost between 800,000 and 1 million new jobs, new jobs. And that there are many issues here involved. You have a lot of employers who continue to tell me that they are trying to not hire more people so they can stay under this 50-member threshold, or they're very, very uncertain about the cost of this. They're deeply concerned about the hundreds of billions of dollars in new taxes, and all those things leave businesses in a position where they're concerned about growth and holding back.
The Senate, what's your understanding of whether it plans to take up a similar bill?
Well, I'd like to think that the Senate would go ahead and give it an up or down vote and rule on that. Of course, we're deeply concerned that many of the jobs bills we've sent over to the Senate, 30+ of them, have not allowed to even been taken up for a vote. And that concerns me because we want to see some bipartisan work here. But the way things work in Capitol Hill, the House passes a bill, the Senate will then act on the same or similar bill amended, and then a conference committee is formed between the House and the Senate, Republican and Democrat members. They sit together, they hash out the differences they presented for all of us for a vote. When it doesn't even come up in the Senate, you can't get to that level of working out some bipartisan cooperation and coming up with a bill for a final vote. And so that concerns me on multiple levels.
So before we go to calls, the numbers suggest the House can pass this, but the numbers also just suggest the Senate would not. What happens then for you and the GOP? You've made an attempt to repeal, but back to that mantra from a while back, repeal and replace. What exactly would you do to replace some of its provisions if you had the chance?
Well, there's several things. Again, the massive amount of bureaucracy I would hold off on. Let's go back to the original concerns that you had 9 or 12 million people who were without health insurance. And the estimates are that even with this law passing, you're still going to have several millions of people without insurance. So it doesn't solve the problem. The costs are one of the factors that drive people away. With healthcare costs increasing, this doesn't solve that problem. It simply raises taxes to cover some of the things. And by the way, not enough tax. We'll still be in huge deficits after this. So you allow people to join groups. One of the big concerns I have from individuals or people who have a very small business or just business of their own is they can't join a group and have the purchasing clout of a large group. So you let people form those kind of groups, whatever it is, whether it's people of similar kind of business, whether it's church groups, communities, whatever that is, let people form groups. Second thing is to let people really shop around. You're very, very limited now, oftentimes, not just by your state, but by your region. Shop around the country. Do those things. I'm a big believer that community health centers, which is supported by both parties, have been a huge cost factor in decreasing costs. You have a health care home for people who have low income, sliding fee scales, a lot of specialists there. I've had a bill in for a while that's moved forward in the House before, not going anywhere else, that would allow doctors, for example, to volunteer at community health centers. It would save billions of dollars for families on health care costs and for those clinics as well. There is also a very important factor of continuing to say you can't be cut from your health insurance because you have a pre-existing condition. That's extremely important because, after all, health insurance is supposed to be there when you're not healthy. And if we don't keep that in there, then I think that's a false thing that keeps costs down. When people are really hurting, we shouldn't be cutting them from health insurance.
Lots of calls coming in for the congressman, who again is co-chair of the GOP Doctors Caucus. Our guest represents the Pittsburgh and Greensburg area, southwestern Pennsylvania, and our first call is from Stevensville, Maryland. It's Bernadette on the independent line. Hi.
Oh, good morning.
Good morning.
And thank you for taking my call. I'm a longtime fan of C-SPAN, one of the few places to get real, independent, non-biased news in government. So thank you for that. I had a couple of points for the doctor. It's a privilege to speak to you as well. My first comment is, as a citizen, my frustration that this health care bill was voted in when it wasn't even read, which I think just violates the rights of citizens who elect officials to represent them. How can you represent someone when you vote for something you haven't read? So it should have been thrown out for that reason. But secondly, now that it's been passed, my frustration is that it takes doctors out of medicine, making decisions. I have a friend in Oklahoma. Her child is disabled. She now lives in Virginia, and he's on social security disability, severely retarded, and cerebral palsy patient. And his doctors write letters to get tests for him, and the government just denies it. So that's going to happen to everybody, not just patients on government health care now. And secondly, my own husband is a physician in nuclear medicine, and he has cardiologists telling him that they are not referring anymore. They are not providing services because they're not getting either not paid, or they're getting the government telling them that the service isn't needed. So a panel really does decide what people get, and if people don't realize that, they're very foolish. So those are my comments. And I wholeheartedly believe this bill should be repealed and looked at, where spending does need to be cut in medicine, but they're going to cut it by cutting services to people and not really looking at where health cost is being misspent.
Thanks, Congressman Murphy.
Thank you, Bernadette. What you point out there is this Independent Payment Advisory Board, which by law has to be less than half of the people on that board are people with a health care background. Doctors, nurses, whatever that might be. Less than 7 out of 15 members are medical fields. Other ones, ethicists, economists, consumers on that panel will be making decisions of what will be paid and how much they will pay. And that is the deep concern, because if they decide not to pay for certain treatments or conditions at certain age levels, that's when it gets to the point when people start to raise the questions, well, why would you not do this for someone who's 60 or 70 or 80? Why would you not do this because of this person's level of disability? One of the battles that I fought in the 1990s as a state senator in Pennsylvania was our own patient Bill of Rights. And at that time, the battle was with managed care companies who were making similar decisions. You know, I myself had patients where they said, well, this child's autistic, he's not going to get better, you don't get any more sessions with him. And I'd say, but there's a lot of things we could do for someone with autism or someone with disabilities. They said, nope, that's it, you're done. I fear that whenever you have a bureaucracy detached from the doctor-patient relationship, you're making decisions that are not necessarily science-based or evidence-based medicine. We do know that when you do evidence-based medicine, where you have the academies of medicine, pediatrics, family medicine, dentistry, whatever it is, that set up their own systems whereby they make recommendations of what should and not be done for patients, there can be huge cost savings. Such things as routine EKGs, routine chest x-rays for people without symptoms, MRIs for people without other types of symptoms, to conclude that can be massive savings. Along those lines, understand those are the colleges and academies of medicine making those recommendations, not government panels. We would do well to follow doctors' orders in reducing costs.
Here's a headline: Texas governor rejects Medicaid expansion in, quote, Obamacare here. As a former state legislator, We'll let the audience know that his state, they're talking about Governor Perry here, his state is home to the highest percentage of uninsured Americans in the country, but Rick Perry on Monday rejected the Medicaid expansion in the president's health care law, saying it would be too expensive in the long run and give the federal government too much sway in state affairs. Any thoughts?
Well, Pennsylvania itself is going to face about $150 million per year that they have to make up, and the Pennsylvania budget is already one that's been crushing. They have to make a lot of cuts they don't want to cut. One of the things that states are asking for is some control over this, and that is if they're able to make some decisions on how to run Medicaid more effectively and efficiently, they'd like to be able to do that. In fact, many governors said, we'll even take less money if you let us do this right, as opposed to managing out of Washington, D.C. That is an option worth looking at, and one worth turning over to the states where they can do that. The states are closer to their constituents, their patients, with regard to that, can more carefully monitor that with regard to effective medicine, with regard to fraud, and making sure they reach out to people in need. And there are some things that these states are asking for which would be a better way of stretching the dollars to cover more.
Caller from Atlanta now. Eric, Democrat, good morning.
Good morning. Representative Murphy, you are real disingenuous. First of all, I found out the reason why you Republicans want to repeal the health care law. The congressmen and senators, I found this out yesterday, you all will have to be a part of the Health Care Act. This is one of the main reasons why. Are you going to sign up for government health care also?
I didn't understand what you said. Could you hold on 1 second, Eric?
For the surplus for the month of April. This shows that the president is working. You had a representative from your state said that they are deliberately trying to suppress the vote. But what I would like you to explain to me is this. Since you all do not believe in socialized programs and government insurance, why do we substitute the taxpayers? You guys are not doing nothing, but we subsidize you, your family members, and also you get pensions and things for work that you are actually not doing. We need to put a time clock on the floor where you people will have to be up there and actually work together, and you get paid for the hours that you spend. You are gravy train. You realize that being a doctor,
can I ask
but
you
went to Washington.
Eric,
Eric,
let me jump in. The congressman has a question.
Yeah, I was trying to hear what the first point you were saying here with regard to, and I'm not clear what he's saying with regard to. I thought he was saying that the Congress may want to change because we are or are not in the program. Initially, the way the bill was written is it said that they members of Congress and leadership staff would not be covered by the bill. We put an amendment in to say that everybody has to be in this plan. You can't exempt Congress from it. Congress ought to be in the same kind of plan. If it's good enough for the American people, good enough for Congress. The issue is, and it's unfortunate that he gets into name calling. That's not what this should be about. I look at this from the standpoint of I've dedicated my life and career to helping patients and working with families. And if I thought this was a mechanism by which we could do that a better job, I'd be in support of it. My concern is it's more walls of bureaucracy between doctors and patients. We don't get any closer to resolution by calling names and by saying that people aren't working on this. I'll tell you, I know a lot of good people on this Hill, Republicans and Democrats, who are genuinely concerned about doing the right thing. Now, that never makes the paper. That never makes the news, say people are really trying to work together. But people who are genuinely concerned. And Democrats and Republicans who say there must be some other way. Like, how do we handle those who have chronic illness? 90% of Medicare costs are chronic illness. How do we help those who are in high-risk pools? I still think there's ways of doing this that you don't have to say everybody has to have the same plan for the same thing. That's when we get into trouble there.
You mentioned the bureaucracy. One viewer via Twitter has this question. Other than the mandate, which we've talked about, what is there not to like about this bill?
Well, it is a huge issue with regard to what I mentioned about the multiple layers of bureaucracy within this. I mean, think of it this way, and this goes to an earlier caller too. If a doctor is recommending certain treatments for you, and it's not covering the bill, it's that we're going to cover a smaller portion of this, and the physician cannot treat you for that amount of money, can't handle it. It's left to the patient to come up with the money themselves, or what do they do there? If you want to change that, the way that the rules of the IPAB board are set up, it literally takes an act of Congress to change that. This group that comes up with these regulations is totally independent of Congress. We have no power or authority over them unless a law is changed. It shouldn't be that way. It should be a system whereby a physician can review and make appeals, et cetera, more directly and not have to circle all the way through Washington, D.C. and decide who it is in this panel and have them come up for a new vote. It just shouldn't be that way.
Caller now from Tennessee, Petros, Tennessee. It's Paul, Republican. Good morning.
Good morning. Good morning, Mr. Murphy and if you happen to see my Congressman Desiree today, would you tell him we said hello here from Morgan County?
I will.
And listen, I just have a quick comment and a question for you. Okay, this health care bill, if our government can force us to take something that we don't want or don't need, therein by taking our rights completely away from us, can you or anybody tell me what in the world are our men and women fighting for over here? They're fighting for nothing. They need to bring them home. This administration has just went completely off the deep end. He's hired every crook there is in Wall Street, put him in his cabinet. We get 3.5 years down the road, look back and say, wonder how this happened.
Let's hear from our guest.
Well, let's look at what the Supreme Court said about this. They did say that the Commerce Clause held firm. In other words, Congress cannot pass a law that makes you buy something. The irony of this, and what Justice Roberts wrote in his majority opinion, is that Congress can, however, tax you for it. And this has put a lot of people into a situation saying, well, where does this power end with Congress? Before we knew Congress could tax you for doing something, and laws of federal and state government can fine you for doing the wrong thing, what's defined there, and when you don't do something like wearing a seatbelt or something. But to fine you for not buying something is a different issue. The Supreme Court said that this is a tax. Now, along these lines, the great irony of does this really help us on health care is if a person says, gee, it's going to cost me a little under $700 for my extra taxes when I'm filling out my tax form because I didn't buy insurance, but if I bought insurance, it would cost me several $1,000s. I'll take the fine. Or in some cases, people may say, I won't do either. When you have an open enrollment period and people can sign up at any time, one of the concerns they have here, as you've seen in other countries, that people actually sign up what's called an ambulance application. You're hurt and in the ambulance, fill out the form. Do you have health insurance? No. Quick, sign this so you'll have it by the time you get to the hospital. That doesn't take care of the issue of the uninsured. That doesn't take care of putting more money into the pool to help cover those in need. And I believe we're still left with the same problem we had at the onset, that many people did not have insurance. It's really not worth it for them to buy it now, and they may just take the fine instead. But it still comes down to the question you say about how much can government compel people to act in certain ways or do certain things in terms of purchasing things, and that's a big question that citizens have on this country.
Viewer via Twitter wants to know more about this Doctors' Caucus. Is the House Doctors' Caucus bipartisan? Is the guest more representing the caucus, the party, or doctors in general today?
It's the GOP Doctors Caucus, and we have 20-some members of physicians and psychologists and nurses, dentists, a wide range of practitioners.
Is there a caucus on the other side?
There is a Doctors Caucus, but quite frankly, it hasn't met in years. They haven't been together in this. There are a couple of physicians and professionals on the other side of the aisle, but that hasn't met in years.
To today's vote, what do you think in terms of Democratic support for the GOP bill? There's a story in Hill today that says Republicans are suggesting that some vulnerable Democrats this election season will back the GOP bill. What are you expecting?
I think there'll be a number of people who will do that on the Democrat side, who will recognize that a lot of their constituents simply do not like the way this is going. Understand some of the levels of what this means in terms of the hundreds of billions of dollars of tax increases. That's not necessarily giving us the resolution. You know, when people talk about support of the bill, there's things that many of us agree on. We want the uninsured to be insured. We'd like it to be affordable. We'd like it that if people who have a pre-existing condition, they can still get health care, or dependents can remain on their policies of their family. But this bill doesn't get us there, and in fact costs us more on several other levels with several other things. And I think that's where a number of Democrats will say, with election season coming up, it's pretty difficult, and they're going to have to really take the pulse of their constituents on
Stay
this.
on elections just for a second. The Hill story goes on to say the GOP's hope is that a strong House vote and fresh Democratic opposition will thwart the White House's effort to boost political support for the law in light of the court ruling, said one House GOP leadership aide. But Democrats see an opening for their side as well. They point out that on Monday, a party campaign committee launched web ads targeting 7 House Republicans ahead of the vote. The video slammed the GOP members, many in vulnerable seats. And here is one of those ads right now.
Carla knows the breast cancer screening she got saved her life. Carla doesn't know that her congresswoman may vote to repeal the law that added preventive coverage to Medicare. But she might. Your member of Congress may vote to repeal important health care benefits for everyday Americans, but she protected generous health plans for Congress at taxpayer expense. Tell Congresswoman Mary Bono Mack she shouldn't repeal our benefits if she wants to keep hers. The Democratic Congressional Campaign Committee is responsible for the content of this advertising.
DCCC ad there. Any thoughts?
Well, look at the things that I just mentioned that we support. Certainly like prevention, and certainly we want to make sure that people with pre-existing conditions maintain that. I find it interesting that, you remember it's a 2,700-page bill. Some of those things are just one sentence long. And what happens to the other 999 pages in this bill? There's a lot in there that's a deep concern, which actually get in the way of that. And look at some of the recommendations that have been made in the past recently with regard to reducing the number of screenings that women with breast cancer have, the number with prostate cancer have. When these are adapted by government panels, Congress can't vote on this, or it would take the House and the Senate and the White House to vote to change those things. That's what concerns me. If someone needs a breast cancer screening or prostate cancer screening or any other kind of screening, I want the doctor to decide that. I also want the doctor to be able to say to the patient, look, we just did this test for this. You don't need it again. We'll keep and monitor your situation. You're not without symptoms. And so this is an unnecessary test for you at this time. All these are important. Plus, look at this. The issue with regard to free prevention. I've always been puzzled how they come up with free on this. Because if prevention services are offered, somewhere they have to be paid for. And that they say, well, the insurance company will pay for that. Well, how do they pay for that? Well, they're offering it for free. Well, someone's got to pay for those tests, those x-rays, those procedures, those blood work, etc. And so that goes into some other area of this. Look at one of the things where I think this is also a bit disingenuous. When they took away money from Medicare, nearly $500 billion, part of that was to cut out the program for Medicare Advantage. Now, this was said, they said, well, we're going to take money out of Medicare by saving it. How are you going to save it? By not paying doctors and hospitals for these services. The Medicare Advantage program, one of the things that the Medicare Advantage program has is a lot of prevention services. One is a health and exercise program for seniors. Extremely important because those seniors who remain at home, alone, sedentary, inactive, have a much higher risk for hospitalizations, health problems, etc. Those who are out doing things, remaining active and physically healthy, have a lower rate for that. That's cut unless they pay more for Medicare Advantage out of pocket. Similar thing for managing disease of those with chronic illness. Medicare Advantage did some of that. So it is wrong to say that some members are against this. We'd like to see some of those programs remain, but they've been cut as part of this bill.
Back to calls. Broken Arrow, Oklahoma. It's Ann on the independent line.
Hello, Dr. Murphy. It was really interesting what you brought up about that was brought up in the commercial about the breast screening, because wasn't it this administration that was trying to promote a standard of doing fewer breast screenings or waiting until women are older to do that? And it's really interesting to hear that. But one of the things that I was wondering about is there a place where, given that this bill is so huge and so complicated, and Nancy Pelosi told us they have to pass the bill before we can find out what's in it, and she hasn't done that, is there a place we can go to get the details where they're listed out in a fairly easy-to-digest form and really get really informed about it?
Thanks, Ann.
Well, the answer is yes and no. I mean, certainly you could obtain a copy of the bill itself. Many members of Congress have connected on their website a link to do that. You can also go to Thomas. C-SPAN has many links, too, that you can look to, but it's worth reading the bill. It's a long and difficult read. Understand of this bill, it's less than 3,000 pages. Many of the references that it makes to other bills, other laws, is itself thousands of pages more, so you'd have to understand those. That's the yes part. You can at least read that. There are analysis online. I would suggest you read multiple sources of that because some of them will be less than factual or have different analysis of them. It is important, however, to understand all the sides of this issue. The part that you won't know yet are all of the regulations yet to be written. And some of those regulations may, I believe, thwart congressional intent. One of those was the issue that was brought up by a former congressman about making sure that things like abortion and abortion services were not paid for. The word was we didn't need that in the bill. The president would write an order, an executive order to prevent that. And next thing we know, Secretary Sebelius is offering a regulation that says that religious affiliated institutions would have to provide contraception, abortifacient drugs somehow under the category of free, but they had to provide that, which is, I think, a violation of that executive order. So when Speaker Pelosi said we had to pass it to find out what's in it, we're still finding out because much of this has yet to be written. And again, that's a big concern. People are asked to swallow a medicine that hasn't been prescribed yet for a condition. We don't know the diagnosis, but we're worried about the side effects. It is very important that a lot of those regulations be out there so we know them, can really discern them. Again, keep this in mind. In many cases, Congress won't have the ability to overturn those unless you get the House and Senate and the White House to agree.
Democratic line now. Linda, Harriman, Tennessee. Welcome.
Good morning, Representative. I'd like for you to repeal the law. People's not talking about the insurance rates going up because my husband found out yesterday that as of the first of the year, the insurance rates will go up. And everybody that I have talked to has said that either they might as well quit their job, go on free health care, free housing, food stamps, or I told them they had a better choice to go ahead and vote the Democrats out. And I am a Democrat, but I intend to vote them out.
Well, here's an example, you're from Tennessee, of what happened when you had a government-run health care. The 10-care plan is seen as a model of how not to do things. It was one that really crippled the Tennessee budget when many of those aspects were put into place. And it helps open up the broader picture when you talk about the cost. Will people just quit their jobs and think, I'll just be on the government dime for all this? When you look at over half of Americans have some or all of their income coming from the government, which means other taxpayers are paying for it, I get very concerned that part of the American dream that I still believe in, that many of us still believe in, is the idea you work hard, you strive, you can achieve something and reap the benefits of that. We've gone into an era here where there's also a lot of disdain created for those people who are successful. Look, I don't agree with the president when he goes around giving speeches criticizing those who are creating jobs, who are successful, and somehow we have to raise taxes on them almost as a political punishment for them for being successful. What I don't hear is encouraging people to participate in that great American dream. I'd also like to hear more of us saying, look, if you can work, you should do it. It goes to that old adage of those who can, those who can't, and those who won't. And for those who can, the great thing about this country should be work hard, play by the rules, don't cheat, achieve as much as you want, and go and follow that dream. Those who can't, we should be compassionate to reach out and help people who are disabled, who have learning problems, who have other major disabilities. Help them where they need help, but also encourage them to do what they can on their own. And those who won't, those who defraud the system, those who cheat the system, are people who should be punished by the system.
You touch on the tax issues out there. Here's a little bit from the president yesterday on the Bush-era tax cuts. I want to get the reaction from the congressman.
While I disagree on extending tax cuts for the wealthy because we just can't afford them, I recognize that not everybody agrees with me on this. On the other hand, we all say we agree that we should extend the tax cuts for 98% of the American people. Right? Everybody says that. The Republicans say they don't want to raise taxes on the middle class. I don't want to raise taxes on the middle class. So we should all agree to extend the tax cuts for the middle class. Let's agree to do what we agree on. Right?
President laying out that 250,000 figure again.
Well, and he also said he didn't want to raise taxes in the middle class, but quite simply, there is a massive amount of taxes that are raised in the middle class. There's many taxes in the health care bill, everything from medical devices to increased Medicare taxes that are in this bill, and taxes on drugs, tax on insurance that are all out there, and people are going to end up paying those. There's also the issue here with regard to when he says we ought to be raised taxes. My question is why? Now, look, the federal government runs on tax revenue, and when people talk about raising taxes here, there's several issues we have to ask. Is it being done to reduce the deficit? And I think in this case the answer is no. The taxes he's talking about raising on people who make more than $250,000 a year would run the government for about 8.5 hours. That's not a deficit reduction. You also have to reduce how much government spending. Is it for expansion of government spending that's necessary? For war? For infrastructure? No. The stimulus bill, I think, was a failed bill in terms of it lost more jobs than it gained. We can do things to help the infrastructure, and one of those things is to bring in new jobs and new money, such as if we drill for oil and gas off the coast. we can create enough federal revenue over 20 years to pay for our roads, our highways, bridges, locks, dams, airports, water and sewer projects to the tune of over $3 trillion without having to raise taxes, without having to borrow from China and go into deficit. I think what we're looking at here is that through polling, someone's decided by setting up the boogeyman, the demon of the wealthy American here, and punish them because you can get some political points, I fear that that's what's happening here. When you ask a group of people, would you rather that this person who makes more money to have their taxes go up and yours go down, it's no wonder that 70-80% of people say, sure, absolutely, have that person do that. But then when you add to that, that it's not going to have any impact on deficit, we're not going to reduce government spending, then people say, then why are you doing it? Keep in mind that the folks who are going to be hurt by this are those who we want to be creating jobs, the job creators, the people who purchase things. I want us to grow our economy, and you can't grow our economy by continuing to bash those who hire people. It just doesn't make sense.
Before we go back to calls, what are you hearing, if anything, inside the GOP conference on the whole of the Bush-era tax cuts? We've been reading about a one-year extension of everything. Mm-hmm. Timing is also important for various reasons. What are you hearing?
Well, we continue to talk about doing a one-year extension on these things, and the president himself said he didn't want to raise taxes during a recession. And I think that goes for job creators and those who are employees, those who have the jobs. But it also comes down to this point, we have got to reform the tax code. Think of the tax code like this sponge filled with millions of holes, 70-some thousand pages of holes. For example, with regard to employers, if you squeeze that sponge down, you eliminate the holes, but you get back to where some kind of a tax rate which is much lower, not the largest one in the world, but lower to another level where they don't have to be spending $400 or $500 billion a year on accountants and tax attorneys trying to figure out which loopholes fit for them. Eliminate those loopholes, get it down to another level that's competitive so they can focus on investing their money into buying equipment and machinery and employees and wages and benefits. That's an important part of what we would like to get done.
Let's go over to Mary now, Republican, Knoxville, Tennessee. You're on with Congressman Tim Murphy of Pennsylvania.
Yes, sir. I was shocked to hear there were middle tax cuts. We've heard for 3 years Bush tax cuts were just for the rich. But the fraud has already started in this Medicare. Obama's been running spots on the radio and billboards to get people on the SSI. There's a whole cottage industry of lawyers. They'll get you SSI. What happens in these people getting on SSI? And there are millions of them. In 2 years, they go to Medicare. We've been told by the CBO office that in 12 years, Medicare is broke, just at a time when hordes of baby boomers are retiring. And Obama's taken $500 billion out of Medicare. They're going to be adding all these SSI people. That's just more fraud. And Obama has turned this country into a beggar nation. You had Henry Waxman on last week saying, well, it would give people security. There's a well-known phrase, those who will give up their freedom for security deserve neither one. And the Republicans need to fight this with every breath they've got, and if not, then we'll find some Republicans in the next election that will, because we see the nightmare that TennCare has brought to Tennessee. Doctors have got signs on their doors, they won't take them. I had 3 doctors, one retired, one went in an administration, and one left the state to get away from TennCare, and it's just being used by these OxyContin people, the doctor shop, to find one that'll give them the prescription they want.
Thanks, Mrs. Murphy.
She's bringing up an important point. What I said before about those who can, those who can't, and those who won't. Those who can't are those who genuinely have disabilities. And what was created some years ago was SSI in order to provide some supplemental assistance for those families and those individuals who have some disabilities. What has happened, however, and it's easy to check this out, is to look where there's a number of law firms that specialize in getting you on SSI. Back when I had my practice as a psychologist, I'd have parents bringing their children to me and say, can you say that this child's attention disorder is significant enough that they could be on SSI? And I always thought, it's not a disability. We can work for this. They can go to school, but to have an income for this is a problem. SSI has grown massively, and during the first couple of years you provide some assistance, then you go into Medicare with that. It's another thing that swelled the rolls. Those who genuinely have disabilities and have severe problems, we understand and we want to help. But my concern is you have a lot of people that are out there, and I have met some of them who didn't know I was a congressman, but tell me that they're disabled, and so what they're doing is they're getting their disability check and working under the table somewhere else. That's hurting those who genuinely have problems, and we ought to be able to join together on both sides of the aisle and saying, this isn't about creating more disabled. It's about helping those who truly are disabled and getting those off who aren't.
One last call, Landover, Maryland. Cody, Independent. Hi, Cody.
Hi, good morning.
Morning.
It's funny that you say that we turn into Congress, White House, and the Supreme Court to solve our problems when they are the cause of them. I remember not too long ago, we had public hospitals across the country where anybody didn't have to have any money go to a public hospital and get health care. You have small countries like Cuba that gives, with U.S. sanctions, they give their country, every citizen in their country, free health care. But for some reason, Congress can never come together and support American people. But you always are bipartisan with money for anyone else, Israel or anyone else. You come, look, the proper health care that people should have in this country is universal, single-payer, non-profit health care plan. But when that was brought up in Congress, you shot it down because it was good for the American people. Now you want to mix corporations with government. What is the textbook definition of fascism, and come up with this eugenics program that you're trying to pass as a health care program?
I have no idea what you're talking about because 90% of what you said is not true. First of all, let's start with your point about Cuba. Cuba is an incredibly hurtful to their citizens. When they put on a dog and pony show showing people their healthcare system, it's what they show for people from other countries who come to visit. They put people in jail, they murder people, they are incredibly repressive towards their people. So regardless of what you may think Cuba has based upon some pseudo-documentary for their healthcare system, what they do in terms of suppressing the people and preventing freedom is heinous, and it is wrong, and you ought to look more into that. The other issues that where we want to look at this is the bottom line you're presenting is a single-payer universal health care system. My point is this. We want to make sure that you see the doctor you choose get the health care you need at a price that's affordable and going down. I don't believe that this plan that's before us, called the Affordable Health Care Act, is that. And the bottom line is, just because something is universal doesn't mean it's right. And one of the points that Justice Roberts made in his decision is they don't make policy. They don't decide whether this is good health care or not. They're simply telling you that Congress has the power to tax, but Congress doesn't have the power to force you to behave in a certain way under the Commerce Clause. I still believe we have a long way to go in getting to the bottom line of helping people get the health care they need from the doctor they choose at a price they can't afford.
Our guest has been Congressman Tim Murphy, Republican of Pennsylvania, co-chair of the Republican Doctors Caucus, psychologist for 30 years. Thanks a lot for your time and your insight this morning. Coming up, Democratic side of the aisle, Representative Earl Blumenauer